Welcome back to the show. It is great to have Patrick Ripberger back from Meridian Health. We've been busy this month talking about kids and maybe what some people might think is a naughty child or a child that doesn't behave well. And so we're going to continue that conversation by talking about the myth of the bad child. And Patrick Ripberger is here. Good morning.
Right. How are you? I'm good.
All right. So let's talk about I don't know, what are some of these myths? When someone says they're a bad kid, it's not necessarily just getting in trouble.
Right.
Okay.
Right. Well, the reason that I wanted to talk about the myth of the bad child is it's a training or presentation that we put together at Meridian for parents, caretakers, and teachers, and child care workers.
Okay.
Because we were going places and we would hear over and over again, oh, he's just a bad child. You know, little Johnny's getting in trouble. Little Susie's not listening. She's a bad child.
Mm-hmm.
And what people seem to not understand is that there is no bad children. There are children who have needs. And it's about finding those needs. Because at Meridian, we believe that every behavior indicates a need. So it's about finding, why is that child misbehaving? What can we do to help them?
Well, that is something that takes more than just one meeting.
Right.
I mean, you're sitting down and really getting to the heart of an issue over time.
Right, and analyzing it and seeing, what are the triggers, what happens before, what happens during, what happens after a certain behavior.
Okay.
And behaviors could be aggression, they could be anxiety, it could be depression, it could be self-injury. Really anything could be a behavior. I know we all have behaviors every day. I probably have like 20. You can ask my wife or any of my coworkers.
Right, but when I think about problem children, right, or the myth of the bad child, I am thinking Dennis the Menace. I am
right,
thinking somebody young.
Right.
But you mentioned that this could be something that could progress all the way to teenagers.
This could be anybody. Originally, it was designed for 3-year-olds to 5-year-olds, and then we expanded. We helped JUCO one year. We trained their counselors on it for their ages. And it could be teenagers, it could be adults. This could be people that you're working with. The myth of the bad coworker, maybe.
Wow.
Right? Yeah.
Okay, so things just got they just went a little deep for me there, Patrick.
Real.
Yeah, it really did. Absolutely, it got real. Patrick Ripberger is here. We're talking about the myth of a bad child. Okay, so school's going to be starting for a lot of us in just a few days.
Right.
Or for maybe others, like Indianapolis, they are starting back to school today.
Right, right.
So how do we see the signals of someone just going from a bad day to somebody being in a habitual offender, or somebody that really needs treatment right away? How do you find out the difference there?
Right. If the behavior keeps getting worse and there's no way for you to help them with it, and you might need to seek professional help. But there's a lot of ways that you can see a child having trouble and you could just step in and help them. Mm-hmm. Really, one of the biggest things that I try to push in this training is that you should try to be the adult that you needed someone to be when you were a child.
Okay, Patrick, now that's even more deep than we were just a second ago.
Right.
Okay, so you're asking for some of the adults to improve their situation so that they can improve the situation or the behavior in their child.
Correct. It's not just about telling a child what they need to do. It's about changing their environment, changing the way that you do things, changing the way that you interact with them.
Well, so many of us listening to this conversation are going to say, we had parents that said, do as I say, not as I do.
Correct.
So that's not healthy.
No, in a lot of ways it's not. It can be harmful.
I guess so.
Right, and we have the power to be leaders in our children's lives. We can help them improve themselves. We can show them, the not necessarily the right way to do things, but we can help them discover ways of, improving their behavior, improving academically, improving socially.
Mm-hmm.
And it's just really important. I think it's a message that a lot of people don't really hear, because really it's a lot of the way that we're raised. And in this day and age, a lot of people are being raised by maybe their grandparents.
Sure.
Older parents, younger parents.
Yeah.
So we have generations clashing, but that's a topic for another day. So.
Well, Patrick, let's talk about how someone gets some help, or how do they find out more about getting treatment, or whatever that correct phrase is.
Right.
What do they need to do?
If you have a child who you're really concerned about their behavior, and maybe you tried some interventions and you can't get it down at home, and what I tell a lot of people is if there's a time where you feel stuck, that you don't have any direction to go, Meridian Health Services, we have a children and families department that'll help you understand the behavior and work towards reaching your goals.
Okay, that's a good plan. And should we call? What do we need to do?
Yeah, you can call our main number to find an office near you, which is 866-306-2647, or find us online at meridianhs.org.
I appreciate you coming in to talk about this because there are teachers that might see some of these signs,
Right.
parents, administrators in schools, maybe faith-based leaders. Who knows who might be able to start cueing in on some of these behaviors.
Right, and it's about just paying attention.
Yeah.
And a lot of times, I know myself as a parent, I'll be at home, I'll be on my phone, my tablet, my laptop.
Yeah.
I think I'm busy sometimes. Sometimes I pretend I'm too busy to pay attention. But really, it's about putting technology away. Let's notice our children, and let's see how we can help them.
Thanks, man.
Yeah.
Appreciate it.
Yeah,
Thanks for being Patrick Ripberger from Meridian Health. And like I said, we going to try to have Patrick on to help us with our kids and just some other things too. Just, I don't know, it's our mental wellness checkup. I mean, that's sort of what it is. So, that's great. And I appreciate you being able to provide some of that insight for us today. Thanks for being on the show.
Yeah, definitely.